We're joined now by the Secretary of Health and Human Services, Alex Azar. Secretary Azar, thank you for joining us this morning. You said yesterday that the window is closing for the U.S. to get this virus under control. How much time do we have? What do we need to do?
Thanks, George, for having me. And before I get to that, I just want to let you know about a really important announcement this morning that President Trump has secured 500,000 courses of treatment of remdesivir, and this through September. This is the drug that, if you're hospitalized, can reduce the length of your stay by a third. And we're working to make with our states to make sure it gets to the hospitals most in need. Now, as you said, we're experiencing in many of the counties in the southern parts of the United States very serious outbreaks. The governors are reporting that the average age of people testing positive is 35 or younger, many asymptomatic. This is a real call to action. We have all got to, as Americans, act responsibly, even as we reopen, get back to work, get back to school, back to health care. We've got to practice social distancing. We've got to use face coverings when we can't practice social distancing. We have a lot more tools now than we had 2 months ago, but still there's a heavy burden on us in terms of our collective responsibility as individuals when we reopen.
We are also still facing a shortage of testing. I want to show some lines out of Miami, live lines out of Miami now at a testing facility. You see those cars lined up right there. And I was speaking with Governor Hutchinson of Arkansas yesterday. He said we need to double our testing capacity again in the United States. It's time to use the Defense Production Act, he said. Will the president invoke the Defense Production Act to get more testing now?
So we'll use any authorities needed to increase testing capacity. Right now, we're doing 3.5 million tests per week, 500,000 per day, and we're going to be asking our big national laboratories, the LabCorp and Quest, to prioritize testing and collection for those states and the counties that are most impacted right now. For your listeners, if they want to get tested, I would encourage them, go to coronavirus.gov. There's a testing part of that site that will show you the many places where you can get tested. The one place you go to might have a line or a backup, but there are many, many other thousands of places where you can get tested in these counties and local areas.
I also want to show a chart that compares what's happening here to what's happening in Europe right now. You see right there the number of cases here in the United States so much higher than what we're seeing in the European Union, where they have flattened the curve. The EU is now set to ban U.S. travelers, and health experts there look at what's happening here and say we've given up. What's your response?
We most certainly have not. We are very aggressively pursuing this virus. Now, I would rather that we have no surge in cases and no new cases, but I'll tell you what, I'd rather have the historic and robust testing system that President Trump has delivered that is allowing us to identify all of these cases, including asymptomatic cases, than to be like many of our colleagues in other countries where they're not testing asymptomatic individuals. And so they may actually have spread of disease among asymptomatic people. As many as 40% can be asymptomatic or more and not know about it. So I'd rather have this data so we can take the types of aggressive actions that our local, state, and federal leaders are taking to try to get this under control. And we can do it. We have the tools to do it. We've done this just in the last couple of weeks working in North Carolina, in Mecklenburg County, where Charlotte is. You get down into the community level. You test everybody in a community because the traditional tools of contact tracing are important but not sufficient with this asymptomatic spread of disease.
You mentioned the importance of wearing masks. Is it time to make it mandatory in the United States?
Well, you know, we're a very, very broad country with different circumstances. So what's going on in Vegas is different than what the circumstance in Montana is. Our advice remains the same, though, for everybody. Social distance under all circumstances, and if you can't, wear facial coverings. But you don't need a national mandate. What you need are local leaders determining the circumstances in that community. But really importantly, for us as individuals, assess your individual circumstance. Are you or household members at risk and vulnerable? Do you have anyone over 80? Do you have people with 3 or more of these key comorbid conditions that put you at risk? Hypertension, diabetes, obesity, kidney failure. In which case you must be very, very careful. Check out what's going on in your community and follow the advice of local leaders. Are you in a place that has broad spread of disease or not? And what's the type of activity you want to engage in? Is it walking in the park, or is it going to a crowded bar in a community that's got widespread disease? And if over the last couple of weeks you're in one of these hot zones and you've engaged in behavior where you haven't social distanced, you haven't worn facial covering, get tested, protect your household members, protect those around you, protect those in the coffee line in the morning who might be vulnerable and you don't know. Protect them from getting this disease from you.
Secretary Azar, thanks for your time this morning.
Thank you, George.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.